Today we're going to talk about whether or not sleep, lack of sleep, proper sleep, and so forth is really affecting you. A lot of people think, well, I don't sleep 7 hours or more. I sleep maybe 6 hours. Some people sleep 5 hours and so forth. And they tell me, I don't think it's affecting me. I think I'm okay. I can function. I can get things done and so forth. It's not really affecting me. So over the years, because we know statistically and scientifically, if you sleep less than 7 hours, and in fact, it's less than 7.5 hours, we'll talk about that some other time. But if you sleep less than what you need, sleep or lack of sleep is definitely affecting you in ways that you may not realize. If you're not really knowledgeable about the subject of sleep and how it affects the body and so forth, you may not realize how it's affecting you. We know for a fact that sleep can cause cancer. Lack of sleep can cause cancer. In fact, sleep can cure cancer. It can help prevent cancer. It can help any cancer treatment that you are on, you see? So the outcome is much better. We know that it helps with cancer. We know it helps with the prevention, reduction of heart attacks. It helps with all-cause mortality, which means dying from any cause. Could be much better if you sleep better. We know all of these things. We know how it affects obesity and how people who sleep longer, those who live to be 100, by the way, tend to sleep, 80% of them, 8 out of 10, tend to sleep more than 7 hours a night, even at that age, you see. So we know sleep is essential. We know lack of sleep can cause disease. However, how do you know that it's actually affecting you? Over the years, what we had to do was to develop some kind of tool so our patients could use to determine if actually there's any effect on their bodies at that age, be it 20, 30, 50, 80, doesn't matter, if there's an effect that sleep is having on their health. And mainly in the areas of energy, because if there's an active disease, then they may not be able to connect it to sleep necessarily. But if sleep is causing you to have lack of energy during the day, if you're not waking up really energetic, if you feel like having a cup of coffee or some sugary snack at say 3 o'clock in the afternoon, if you get home and you need to have a nap, or you need to have a nap right after lunch sometimes, if you're moody, if your ability to interact, socialize with people is less than it used to be, if you are sort of angry all the time, and so on, all of these little signs indicate that you may want to take that test or use that tool. It's called the 7-day sleep log. Basically what it is, it's on a single sheet of paper. You can log your sleep and quite a few symptoms. And then you can correlate the two, day after day after day after day for 7 days. Then you can take a look at this whole log after 7 days and take an outside viewpoint to that form and decide for yourself if it's affecting you. I can tell you for a fact, having consulted thousands and thousands of people over the last 2+ decades, that in every single case, lack of sleep, I should say, had a negative effect on those individuals. Okay? So this is just an invitation for you to take a look at this and evaluate it for yourself. Also, it's an invitation for you to take sleep more seriously. I hope this helps. Thank you. Hi, this is Dr. Matar again. If you like the video, please give it a like and subscribe so you can get the future videos. If you're new to the channel, what I do here is I discuss cases of my most successful patients who struggled with diet and exercise, yet were able to achieve at the end of their programs a well, fit, and slim life. I want the same for you, so if you have any questions or comments, please send them my way. I'd love to hear from you. Thank you.